Hello dear colleagues, my dear professors. Our goal to expose and ligate the femoral artery for control of hemorrhage, treatment of aneurysm, or demonstration of vascular anatomy. The special indication NG or rupture of the femoral artery, aneurysm of the femoral artery to prevent distal hemorrhage. The patient position is very important here. The patient in supine position, thin, slightly adducted and laterally rotated. The limb is slightly flexed at the hip joint to relax the fascia. To start, anatomically landmarks: inguinal ligaments, mid inguinal point, half between the anterior superior iliac spine and the pubic symphysis, greater trochanter of the femur and the epicondyle of the femur. Take a longitudinal incisions about 8 to 10 centimeter long. Begin 2 centimeter below the inguinal ligament at the mid inguinal point. Continue downward along the line of the femoral artery in the upper thigh border of sartorius muscle. Layer by layer dissection. First, we already cutted the skin, incise and retract borders. Then superficial fascia contain superficial epigastric vessels and lymph nodes. Fascia lata, dense fascia open in the same line as skin incision. Then we have like femoral sheath found deep to fascia lata, surround the femoral artery and vein. Then we have femoral artery lie in the lateral compartment of the femoral sheath. Special femoral triangle. A femoral triangle we have three boundaries: superior boundary, lateral boundary and middle boundary. Superior boundary we have inguinal ligament where the femoral artery passes under this ligament, and this is the main continuation of external iliac artery. And through under this triangle, laterally we have sartorius muscle, musculus sartorius. Medially we have adductor longus muscle, and floor we have iliopsoas, pectineus muscles and adductor brevis muscle. There we have special sheet which are covering the femoral these vessels is femoral sheet. There is a special mnemonic we can use for this sheet: NAVEL, N for nerve, A for artery, V for vein, and L for lymphatic, and E for empty spaces. Under the femoral sheet you can laterally we have femoral nerve, medially we have femoral vein, and between them we have femoral artery. Identification of the femoral artery. A femoral nerve lies lateral and outside the sheath. Femoral vein lies medial to the artery, and the artery is pulsate and can be recognized by its thicker wall and absence of walls. Ligation technique: expose and isolate the femoral artery by blunt dissection. Pass an aneurysm needle from medial to lateral and pass the ligator artery. Tie the knot securely, ensuring the femoral vein and nerve are not included. Collateral circulation after a ligation. After ligation of the femoral artery, blood reaches the limb collateral pathways. We have some branches here, and there we can discuss the anastomosis also. The superior view we can see inferior epigastric artery, medial and lateral circumflex femoral arteries, descending branch of lateral circumflex femoral artery. Inferior we can see superficial and deep circumflex iliac artery, perforating branches of profunda femoris artery, and superior genicular arteries from popliteal arteries. Okay, and then we have the anastomosis region. We can see anastomosis in groin region, we can see in the thigh region, and we can also see in the knee joint.